Hi, my name is Heather Williams. I've been a social worker for many years, and I've worked with a lot of clients that have trauma experience and a PTSD diagnosis. My research proposal involves looking at the difference in trauma-focused cognitive behavioral therapy versus traditional cognitive behavioral therapy in adolescents with PTSD. Post-traumatic stress disorder, or PTSD, is a prevalent problem for adolescents in the United States. According to Bai et al. 2019, symptoms of PTSD is the most commonly difficult for adolescents who have experienced sexual abuse out of all the adjustment issues that they face from their PTSD diagnosis. After trauma exposure, children and youth experience reactions because of the trauma, and this comes in the form of PTSD. It can also come in the form of anxiety, depression, and substance abuse. And that was stated by Uvenstad in his 2020 article. Treatment after trauma and other mental health issues is also a large issue for adolescents. A large number of those adolescents will begin treatment and then prematurely stop treatment. According to McChesney et al. 2015, there are also negative attitudes surrounding mental health treatment, and a higher prevalence of these attitudes is in the adolescents that fall into the age range of a young adult, which is ages 15 to 24. So this study will actually look at the difference between these two different therapy modalities, cognitive behavioral therapy versus treatment-focused cognitive behavioral therapy. The researchers' hypothesis is that the adolescents who receive trauma-focused cognitive behavioral therapy will have less trauma symptoms upon conclusion of treatment than the adolescents that receive only the cognitive behavioral therapy. The null hypothesis is that there will be no difference in symptoms between the two groups at the conclusion of therapy. The study design that I'll be using is going to be a 2-group pre-test, post-test design. This will encompass 100 adolescents that are going to be aged 13 to 17 in the Washington, D.C. and surrounding areas. These students and adolescents will have a PTSD diagnosis, and their trauma experiences will need to be on the DSM-5 criteria A list in order to be in this study. A stratified random sampling method will be used to approximate proportions of the U.S. as a whole, and the adolescents will be divided as such. They'll be divided into 2 groups of 50. The control group will receive cognitive behavioral therapy, and the treatment group will receive trauma-focused cognitive behavioral therapy. These clients will be referred from various mental health and counseling centers in the Washington, D.C. area. They'll go through an intake process to kind of determine their fitness for the study and their, willingness to participate or not. The instrument that will be used for pre and post test is called the Child PTSD Symptom Scale. It is the self-report version that is for DSM-5. The analysis of the data yielded is going to be quantitative and ordinal. The statistical test for this study is going to be the 2-group independent samples t-test. This will be used to see if there's a relationship between the dependent and independent variables. Is that relationship a true relationship? And that is from our textbook, Hepper et al. 2016. This will yield a p-value score. If the p-value is less than 0.05, then the null hypothesis will be rejected in favor of the researcher's hypothesis. Thank you and have a great day.